Thank you, Sarah. Again, welcome everyone to our celebration of Older Americans Month, May 2022. We have an exciting agenda today with a couple of different presentations, but I want to kick it off by inviting DOS Executive Director Kelly Dearman to join us with some opening remarks. There she is. Hello, Kelly. How are you?
Hi.
Happy
Good.
Older Americans Month.
Yes. Hi, everybody. Happy Older Americans Month. I'm really happy to be here and just want to take a few moments to say a couple of things. First, I just want to recognize that it's been a really rough month, a really rough week, really rough 2.5 years, if we're being honest. And so I'm just happy and honored that we can get together today to celebrate a little bit. And at my house, as most of you know, I live with my parents, my partner, and my adult children. And in an effort to bring some joy to our hearts and minds yesterday, I said, hey, at the dinner table, May is Older Americans Month. What does that mean to you? And so my 20-year-old daughter said that for her, it's a time to appreciate the older people in her life, whether they're a coach, teacher, mentor, guardian, or parent, and to really appreciate all that they have done for her. My 26-year-old son said that it's a time to see how much we have learned from the older generation and how they have shaped the world and taught us. My partner, husband, of course, said, oh, that must be referring to people who are older than me. And my mom, my 86-year-old mom said, well, I'm happy to celebrate on behalf of all older Americans. And I'm just still so happy to be here. And my 91-year-old father said, at 91, it's a great opportunity for him to be able to look back and see how much the world has changed and the small part that he has played in trying to make it better. And the truth is, we have these conversations every night at the dinner table. We talk about our lives, what's going on. We are really fortunate to get to hear from my parents about what it was like from them. But he would tell you that that even though we do have these conversations all the time, it's really nice to have a month where older adults, and him in particular, where he is recognized and appreciated. And the truth is, what I will say to you all now is that for the past 2 years, or more than 2 years, the spotlight has been on older adults, but not always in the best way. And so in this month, we celebrate all of the accomplishments, and we recognize that this is a job that we all do together. And I want to give a big shout out to all of our partners, in particular to CASE and the 40 nonprofits that you represent, because it is together that we are continuing to recognize and uplift and highlight older adults and people with disabilities each and every day. And we can take a moment to congratulate ourselves, because it is through this work that we really show what community means and how to create community. So I thank you all for being here. I thank you for giving me this opportunity to say a couple of words. And again, happy, happy, happy Older Adults Month. Thanks, Mike.
Thanks, Kelly. That was great. Kelly, are you leaving? I want you to stick around for a second. Okay, you're sticking around. Okay, here's what I'm gonna try to do. I recently went to a ribbon cutting ceremony, and I thought it was awesome. And I thought, why don't we have something like that in the virtual world? Maybe it's a ribbon cutting, maybe it's the ball dropping. So what I want to do is I'm going to attempt to do the ball dropping here on this webinar today. So Kelly, I want to invite all the all our speakers to turn on their cameras for this. And Kelly, I'm going to have you, I don't know how we're going to do this, but you are going to kick this event off. You are going to, hopefully my screen is up there. Okay, all right. I don't know if it's a declaration. Oh, whoops. I went and hit the button. Dang it. Oh my gosh. Okay, all right. Kelly, please kick this off somehow.
Do you want me to say something? Am I
Yeah, some sort
passing
of
this?
declaration.
Oh, yes.
This event is officially going.
Yes, the event is officially happening, and congratulations to all of us as we celebrate older adults. Older Americans Month. There we go. Applause.
Happy Older Americans Month, everyone. I can't believe I clicked that button. I created that confetti myself. That was my, I was gonna brag about, but I stepped on it there. Okay, anyways, with that being said, let's move right along. I want to invite up our first presenters today. They are folks from the Coalition of Agencies Serving the Elderly. And I think they're going to highlight a project they had been working on that I think is really excellent representation of some of our providers and the work they do in the community. So welcome, CASE folks. I will have you, I'm going to kick it over to you and have you each introduce yourself to the project.
Thank you, Mike. I don't know if I want to follow that big declaration, but we will do our best. Good morning, everyone, DOS staff and partners. My name is Fiona Hinsey. I'm representing Coalition of Agencies Serving the Elderly. As the co-chair, we are joined by I'm joined by also Dan Gallagher, who's also my co-chair, who you'll be hearing from a little bit later, and a couple of providers that are profiled in the piece that we'll be talking about, and also Judy Goddess, who wrote the piece that you'll be talking about, who you'll be hearing from after me. Just an orientation for folks who may not know what Coalition of Agencies Serving the Elderly is, although Kelly gave you a good overview. We are a nonprofit that we have about 40 member organizations, and we advocate for organizations serving older adults and people with disabilities throughout the city. We've done budget advocacy in the past. We've also provided educational services to our providers via presentations and by our membership meetings, but we also just really aim to highlight the work of the providers that really make up the landscape of senior serving agencies in the city. And that's really what we tried to do with this project. So I'm going to give you a little brief history of this project. This project is, so during the early stages of the pandemic, CASE convened a couple of discussion groups where the first primary goal was to talk about reopening back when we thought the pandemic was going to be a little shorter. So we really wanted to create a space for folks to kind of brainstorm together and sort of bounce ideas off each other about best practices for reopening, etc. But throughout that, we really discovered that agencies were making some really innovative service pivots. So we wanted to highlight those. As I said before, one of our goals is to really highlight the work of our agencies and really highlight the fact that older adults are very much contributing to the fabric of our city, and really highlight how the nonprofit sector is a key part in that sort of fabric of the senior and adults with disability kind of culture. So what we did was we wanted to profile some agencies and really explore sort of what their mission was, and then sort of explore how they pivoted their services to meet the needs of the pandemic. as Kelly said, we know the pandemic is hard on everyone. But we really wanted to highlight, like I said, the innovative ways that case member agencies dealt with the pandemic and really didn't miss a beat in the services that they provided. So I think at this point, I'm gonna turn things over to the remarkable Judy Goddess, who most of you likely know because she's written quite a bit about the senior and disability sector in San Francisco. So I'm gonna turn things over to her because she is really the heart and soul behind this project. So I'm gonna turn things over to you.
Thank you, Fiona. That's great. So the takeaway is that 13 agencies responded to a survey that CASE developed on what they had done during the pandemic, during the beginning of the pandemic. And I interviewed all of them and wrote about all of them. Later on, you're going to hear from Sylvia Sherman from Community Music Center and Dan Gallagher from Stepping Stone. But this is just going to be a summary of what we found. So we discovered that all of the agencies worked hard and smart to ensure that their participants were not hungry, isolated, or depressed, and that as many as were willing were vaccinated. We found that the agencies who had not previously delivered groceries or meals helped their clients register for food delivery and assigned staff and recruited volunteers to deliver groceries, while agencies who had been in the food business previously stepped up their efforts so that although many of their clients were unable to leave the house, no one would be hungry. In terms of isolation and depression, we all remember the COVID recommendations: stay home and engage in limited contact with people outside your household. In other words, isolate. Isolation has disastrous effects on seniors and people with disabilities, as well as others, by the way. But agencies develop programs to counteract isolation, like making weekly phone calls to their clients, delivering newsletters, a lot of activity sheets, greeting cards, presents, etc. Though in-person contacts were limited, staff made doorstep visits, and at IOA, a social worker assigned to Mercy Housing used a coffee cart to enable interaction. I thought that was rather clever. While Zoom seemed a promising solution, staff needed to be trained, as did the participants. The inability to meet in person made training much more difficult, as did the absence of internet connectivity in areas of the city, such as the Tenderloin, Mission, and South Market. When the vaccine became available, agencies developed aggressive outreach programs to convince their participants to take advantage of the vaccine, make appointments, and quite often accompany them to those appointments or arrange in-home vaccines when they could not leave their homes. And there's some really interesting stories about that in our report. The increase in anti-Asian racism forced many Asian elderly to stay home. And this particularly affected Bahanahan, BEC Equity Center, Self-Help for the Elderly, and Unlock 30th Street Senior Center, all of whom developed their own escort services or encouraged their clients to take advantage of the existing services. All of these efforts could not have been made without support from DAS. Every agency mentioned the importance of DAS to understanding the problems brought on by the pandemic and the willingness of DAS to redefine contact hours and problem solve with the agencies. Agencies brought in additional volunteers when their staff and partners couldn't handle the work. Community Living Campaign found things for all the reservists to do when the agencies where they were placed closed and had nothing for the reservists to do, had So it was up to CLC to step in. IT Bookman expanded from Felicia Thibodeau and Michael Perkins delivering peanut butter and jelly sandwiches to 40 seniors to delivering meals to 150 seniors a week. And along the way, developing important and powerful collaborations with Mother Brown's, Arcadio's Produce, and becoming instrumental in creating the Lakeview and OMI hub and strengthening it. I just want to say a little bit about the clients. My usual technique for interviewing is to walk into a setting, identify the person or persons I want to talk with, and then just start a conversation. Well, that didn't work during COVID. This time I needed to rely on staff referrals. Here's what one of the participants said from Unlock 30th Street Senior Center, Irving Rivera, who is a volunteer, a teacher, and a participant. He said, at the beginning of the pandemic, we were worried and stressed out. The conversations circle that Unlock started with Dr. Maria Perry was such a revelation. I learned that the mental health part of living was just as important or more so than exercising. We learned how to handle stress, how to be grateful and positive thinkers. Ruth Draper from IT Bookman said, staying home 24/7 is no fun. Well, we can all agree to that. This center gets us out of the house. Robert Ellis, who was also at IT Bookman, added, psychologically, it's good for the mind. I feel blessed. Louis Mascarenas from Computer Tech Network talked about being lonely and isolated before he enrolled in the Home Connect program. After he received his tablet and training, he said he was able to contact his brother in London, whom he hadn't seen in 20 years. Then Louis took his tablet to Bodecker Park and later to the Moscone Center to help people register for the vaccine. Now, he says, after the pandemic, I'd like to be a computer teacher. It helped me change my life. Now I want to help others. My feedback is that the agencies were fantastic. Most of us expected this COVID thing would end quickly, not last for over 2 years. How do you plan for something that may be a 4 or 5 month affair or could continue for years? A difficulty I experienced with the study, I'm going to bring that one up, was that our conversation started casually, but then when the agencies realized we had a document in mind, and with the help of Lena Chu from One More Cookie, it was going to look good and it would be something they could use, our conversations became more earnest and detailed. In some cases, that meant conversations moved up the bureaucracy, which took considerably longer. I think it's safe to say that the pandemic's changed the service model for all agencies. In doing so, they found they could reach some people they hadn't reached before, including the mobility challenged and their participants' family members. Many envision maintaining at least some level of virtual services when it again is safe to meet in person. That's the end of my piece.
And next week, thank you, Judy. And next
Sure.
week we have Sylvia.
All right, hello everyone, and I'm Sylvia Sherman, the program director at Community Music Center, and I want to thank Judy Goddess for that incredible work she did on this pandemic pivot report on behalf of the case agencies and the community, and that was a wonderful overview as well. So I'm very honored to be able to present about Community Music Center's older adult choir program in partnership with 12 senior center neighborhood centers around San Francisco, serving primarily low-income, diverse older adults and adults with disabilities. And we are very grateful for DOS's support. The program started not only being interested in providing the joy of music to older adults, which it does, but also to address issues of isolation, as Judy mentioned, which is a social determinant of health in our older adult community. And our program, which started about 10 years ago, grew tremendously through a partnership with UCSF, which was very interested in learning about what are the benefits for older adults who sing in community choirs? And after 5 years and 12 choirs, we now have an evidence-based research report which documents that older adults who sing in choirs indeed have decreased loneliness and more interest in life, which is are very important outcomes. What we found in terms of the pandemic was that the assets of the program served it well during the pandemic to pivot. The social relationships between choir members, between the choir directors and their students, between CMC and its partner sites, that our slogan was leave no choir member behind. And in the interest of that, as Judy described from so many agencies, we integrated reaching out about the choir program with wellness calls from the agency to learn who could participate in the virtual program that we transferred to. We didn't miss a week of choir. And initially we started by providing YouTube tutorials where people could sing at home and do the exercises with their choir teacher. And pretty soon after that started to move to Zoom so people could interact in real time. But in order to do that, we had to talk to every choir member to see who was able to access YouTube and then eventually Zoom, who needed technology, who needed training. And then we needed to be able to gear up to be able to provide that training. And what we found were that the members themselves were tremendous assets to be able to provide peer-to-peer training. So each choir had a little cohort of peer-to-peer trainers to support choir members who needed help, identifying those who needed access to technology. We were able to work with partner organizations to provide devices and some training to those who needed it. But then kind of on the day-to-day basis at choir session or to get in, the peer-to-peer work was really valuable. And then when we were in Zoom, all the amazing stuff that happens when people are together strengthened the network, even during shelter in place. I remember at one of the first choir sessions that I was part of in the virtual landscape, you know, we were hearing people because they were talking and checking in addition to singing. And, you know, one choir member learned that another one wasn't able to get out and get groceries, so she offered to deliver groceries to her. So that was a part of the life in the online world. I'd say now that we are back into reopening land, the most important thing, we continue with the slogan of no choir member left behind. Some people have come back to in-person choir, others are still participating virtually. We have hybrid sessions where everyone's in the same session, either virtually or in person. And happily they're able to move into performances again in the community, which has always been an asset and has been a way not only for the choir members to receive that affirmation from the community for performing their cultural traditions, for their hard work, but they are healthy aging ambassadors, helping to reframe aging publicly in our communities and offer themselves as outreach, not only for the choir, but for the services that are offered at their partner host site. So with that, I think I'm going to leave it. I'd say that looking forward, we hope to be able, as health and safety conditions permit, to continue to offer in a hybrid way services at new kinds of settings that were interested prior to the pandemic, like senior residences, partnering with churches, with public housing, knowing that that social connection is so vital and that we have the ability to operate in multiple modes. I'm going to turn it over to Dan now. Thank you all.
Hi, good morning, everyone. I'm Dan Gallagher. I am a co-chair of the Coalition of Agencies Serving the Elderly case. I'm also the executive director of Stepping Stone Health. I can see I don't have a lot of time at this point to present Stepping Stone. I think we're running out of our scheduled time here. So I'll just briefly say that Stepping Stone's response to the pandemic, you may know Stepping Stone Health provides adult day health care to about 300 participants on a daily basis in San Francisco. And when the shutdown order happened in March of 2020. You know, my recollection back then, we had such difficulty deciding about our shutting down and suspending in-center services, because we knew that our participants needed the healthcare that they were receiving on a daily basis to maintain their health and to stay at home and to live with their family and their loved ones and their caregivers and be connected to their community. But once we decided, obviously, with the city's stay-at-home order and also the state of California stay-at-home order, we responded within one day. We suspended our in-center services on March 20th, and we opened up our Centers Without Walls program on March 23rd with a small number of staff because we weren't getting paid because we would receive our fee for service from Medi-Cal on an attendance basis. So with a small reserve and the help of several foundations with emergency funding, we were able to not only start our Center Without Walls program, providing telehealth services and wellness calls, doorstep deliveries, and doorstep deliveries of food, adaptive equipment, supplies, anything our participants needed and the families needed, we did. And then we had evolved over the pandemic to provide more virtual services with the help of Community Living Campaign. And then ultimately last July, we reopened for in-center services on a limited basis, and then developed a hybrid model. So we provided in-center services and both virtual services. So those who could not come into the centers, we could connect them to the services that we were providing in center through the internet and the devices that we provided. So that was really helpful. I know I'm running out of time here. So you can see the report for Stepping Stone. We continue to provide hybrid services today. We plan to hopefully fully reopen sometime in late summer or fall to bring all of our participants back into the centers. But it was really an incredible effort on behalf of the staff of Stepping Stone to initially provide the telehealth model, the virtual model, and then the hybrid services now. And really an incredible effort by our participants and their families, their caregivers, to be able to continue to stay connected and engage with us and maintain their health for the last 2+ years. So we're really proud of the effort made by the organization and also the participants that we serve. Finally, I'd just like to make some acknowledgements on behalf of the Coalition of Agencies Serving the Elderly. I'd like to thank our partners from the Department of Disability and Aging Services, Kelly Dearman, their executive director, and in particular, Mike Zog, who's been a really active partner in this effort. So thank you both. Judy Goddess, obviously, who you've met just a couple of minutes ago, and the reserve staff of the Community Living Campaign, and in particular, Jamie Goddard, who was really helpful in the earlier discussion groups that we had in our efforts that Fiona had mentioned. I want to thank Helena Chu of One More Cookie Communications Design. Helena really made the effort, the final product, a very professional piece for that really illustrated the incredible work by all of the organizations that took part in the case pivot project. And then I'd also like to thank Greg Moore. Greg Moore is a former co-chair of CASE, and Greg was instrumental in getting this project started early on, well over a year and a half ago now. So Greg works for the Tenderloin Community Benefit District, and I just want to mention his involvement as well. And then lastly, I really want to thank all of the organizations that participated, their staff, their clients. Really, without them, this project would not be doable. And it just illustrated, I think, the incredible spirit and the passion that these organizations, not only the organizations and their staff, but also their participants have. And finally, what they were able to do to keep their clients, their participants connected, engaged, and healthy through the pandemic. And then finally, I just want to thank my co-chair, Fiona Hinsey. Without Fiona, Fiona just kept us on task throughout the entire project, and just kept us moving in the right direction. So thank you, Fiona, and I really appreciate the time to talk with you all today. Thank you. Bye-bye.
Awesome. Thank you. Thank you so much, Dan. Thank you, Fiona. Thank you, Judy. Thank you, Sylvia. Super appreciate you guys joining us today. Definitely, folks out there, if you have not seen that report that they were reporting on, go check it out. You can download it off of the CASE website, case-sf.org. We will, I think if it's not posted in the Q&A, certainly it'll be on the materials, and I have a slide at the end where you can get that. Moving right along, I am now going to jump in here for a couple minutes and talk with folks about a brief history and review of the Older Americans Act. Why? Well, because I think we don't do it very often. There's not a lot of opportunities. I think it's a foundational piece of legislation that really raises awareness around aging and aging services, as well as supports, provides funding and other supports that enhance the aging services across the United States, including development of government agencies such as the Administration on Aging, which help launch and support Older Americans Act, or Older Americans Month each year. So all right, I'll zip through this as best I can. So the Older Americans Act is federal legislation originally passed in 1965. Over the years, it's had subsequent reauthorizations and amendments that it has evolved over years. I think we saw through the first half of the 20th century, particularly through the 1950s and 60s, increased recognition around aging in the United States. There was a number of sort of White House conferences and increased awareness of thinking about aging, recognizing that older adults didn't have a lot of support in the community and were having poor economic and health outcomes. As a result of that, we saw the creation of and the passing of the Older Americans Act. I think that we'll get to what that is. It was part of President Lyndon Johnson's Great Society domestic agenda, which people may have heard of, but I think is worth mentioning again. The Older Americans Act is in very impressive company. The Great Society was a series of legislation that was just pioneering and wide-ranging in its scope and really transformative for the experience of people in the United States. just some of the things passed in that same range: the Civil Rights Act of 1964, the Voting Rights Act of 1965, the Immigration and Nationality Services Act of 1965, the Social Security Act of 1965, which created Medicare and Medicaid, the Economic Opportunity Act of 1964, on and on and on, significant legislation in all kinds of other areas, including education, transportation, traffic and vehicle safety. Some of the first regulations on packaging of foods came around then, and warning labels on cigarettes and things like that. Really, the Older Americans Act was part of really a shift in how our life is in America. I think there's a lot of attention to voting margins now, with down to 1 vote and tiebreakers. You know, the Older Americans Act passed by wide margins in the House. It passed 395 to 1 and 72 to 5 in the Senate. Broad support. I have a little hyperlink here, which will be helpful when people look at the slides. It takes you through to the legislation. Yes, it's pages and pages of legalese and jargon, but I put it there in case you're curious. Sometimes I find it's interesting to read through these things and to see how they're laid out, and there's a lot of different ways you can things you can learn and pick up that are interesting in there. Let's talk about the purpose of the Older Americans Act. And you know, the Older Americans Act starts with a really interesting declaration of findings. You know, it says that there is an inherent dignity of the individual. That's part of the American tradition. And it states that, you know, older people are entitled to, and it's our duty to assist in the following areas. And it lists specific areas where there is a responsibility to assist in the aging process. And these are things like adequate income for retirement, access to the best possible health and restorative services, regardless of income. Restorative services there is a broad term. It includes both institutional care as well as community-based supports to keep people in the community, including caregivers, formal or informal caregivers. It calls for suitable, affordable housing. It calls for employment opportunities free of ageism or other discrimination. It calls for meaningful participation in the community, as well as giving people independence in planning and management of their lives. It calls for protection against abuse, neglect, and exploitation. I think these are all things that we can agree with. Kind of some of the big chunks that are kind of established through this legislation. You know, one of the big ones is it establishes the Aging Network, which is sort of a term, which includes the Administration on Aging at the federal level, but also sets up state units on aging, of which there are actually 56 state units on aging, fun fact, because that includes District of Columbia, Puerto Rico, Guam, the Virgin Islands, the Marianas, and American Samoa. It requires coordination among these entities. So we have the ability to communicate and collaborate from a local level up through the federal level. It provides funding, perhaps most importantly, provides funding that is passed down through this network to provide for services in the community. It also identifies and establishes specific programming areas to be established and implemented. Specifically, there are quite a few in the Older Americans Act, but some of them include the nutrition programs, which you know about, congregate and home delivered meals, family caregiver support, health promotion and disease prevention programs, employment programs. The Ombudsman program is referenced in the Older Americans Act. Elder abuse prevention programs are mentioned in there, as well as what they broadly call supportive services, which is sort of a broad umbrella thinking about programs in this community-based services designed to help people live as independently as possible. And that includes transportation, case management, legal services, adult day programs, and community centers. I do want to note, I do want to note here as an asterisk that, the Older Americans Act also specifically speaks to Native American populations and tribal responsibilities. I do want to sort of call that out. I'm not going to go into that as it's not an area I'm super familiar with, and I only have so much time right now. But I do want to note that that is in there as well. And the Older Americans Act does provide some of the spectrum or the portfolio of services for Native Americans in the United States. Okay. Why is this important? Who cares? Why is the Older Americans Act important? And I have a couple of reasons. I think for the first one, the reason why it's important is it's true. I think that we absolutely need to be aware of aging, and we need to be thinking about how we support our community as we age together. I think that there are interventions and supports provided throughout our lives, from children through adulthood into older adulthood, and being aware of what those needs might be and being there to provide them. It also spells this out as a value that we share, that we need to be thinking of aging and being, it is in our cultural values to provide and care for others in our community. It serves as a reminder that there is work to do. I think that we're not good to go. We got the Older Americans Act, see everybody later. I think there are aspects of this that we are not meeting. And I think that this is an opportunity for us to continue to work towards the goals that are in this document, and to continue to progress and grow how we serve the community in this sphere. It provides funding, which is very important, and guidance for program areas. It's also a foundational piece for that aging network. And I think that why that's important is that sets up a system of exchange and collaboration that serves multiple benefits. It allows us to work with the community at a local level and understand need. It allows for advocacy, innovation, cultural exchange along through that network to overall help us continue on this mission and improve our services in the community. Okay.
Okay, Mike, there is a quick question.
Okay.
Has there been any expansion of specific program areas over the years? Does eligibility for any of these programs require being on Medi-Cal or are income based?
Okay. Yes, there is. So the Older Americans Act has been, it has grown over the years. It is reauthorized and re-amended every handful of years. It has grown quite a bit from what it was in 1965. We have seen through the 70s, I think we saw development of a lot of new programs. Not quite fluent in where we saw the changes, but I can tell you that in the most recent iteration, which I believe was reauthorized in 2020, we saw the first time that it specifically started to recognize social isolation as an issue and allowing for expansion into programs targeting social isolation. There's a second question around eligibility. And I think this is another important thing to mention is that generally eligibility for Older Americans Act programs is just simply that one be age 60 and over. There are actually some limited exceptions for people under the age of 60, but there is generally no income or other eligibility requirement. We are asked to always sort of target or focus our services to those with the greatest economic and social need. But I think that it is broad, and I think that I like that, in that this is something that is for all of us to participate in. It is not necessarily for, limited aspects of the population or things like that. Okay.
Great. Thank you,
That's it,
Mike.
Sarah. Thank you,
All
Sarah.
right. So with that, thank you, Mike. That was great. I would like to welcome Dr. Anna Chodos, the Director of the Division of Geriatrics at UCSF. And she is here to talk to us today about her the amazing 80/80 project. So I'm going to turn it over to you, Anna.
Thank you. Thank you for the promotion. I work at the Division of Geriatrics, and my boss is someone else, the chief there, but I'm the director of the 80/80 project. Sorry, so my slide was misleading, and I will humbly submit my true status at the division. But I think one relevant thing is just that I'm a doctor and I work in outpatient medicine for UCSF at the General. So I see patients at clinic at San Francisco General, which is how I personally get to work with and get to know so many older adults in this context of providing that kind of care. So as part of today's celebration, which is wonderful, I feel so humbled and so grateful for just hearing about all the work that everyone else is doing to support older adults if they need support, and how that happens, and how we have legislation and support from the Older Americans Act. It's obviously such a core part of what improving and supporting dignity in America for older adults is all about. So just really cool to hear about everybody's work and to be reminded of the background about the Older Americans Act. I'm just also so thrilled to have this opportunity to present this project really on behalf of so many people who have put work into it, and really welcome your thoughts about the project. So I think we're mostly going to hold questions until the end, but I would love for your thoughts and comments about the project. Our website is here, 80/80. Whoops, I have a very, this is a very tricky mouse, but we have a website that you're welcome to peruse while I'm talking if you're a multitasker, like I know many of us are these days, especially on virtual events. But let's get started. So in the remaining time that we have today, I was going to go over why we did this project. It's really the implicit underpinnings was we're an aging city, and ageism affects us all. And so this might be one way to celebrate that we're aging, and celebrate that a lot of us are working in reducing ageism as well. I'll talk about what we did, sort of how we did it, what the project even is. And then at the end, we have some clips of stuff from the interviews that we've posted on our website. Now all 80 are up there. But we did a little test run before we got started, and it's a little hard to hear with the virtual environment, some of the words. So we'll go over that when we get there to make sure everybody can at least get a sense of what the clips are about. Okay, so let's dig in. Why did we do this? Well, it really was, I think, just clearly, not to put the project down in any way, but it's a simple idea. We've all seen 30 under 30 lists, 40 under 40 lists. And at the end of the day, what the messages that those give are that we're celebrating achievement, and we're celebrating achievement at a young age. And so in some ways it does celebrate youth culture. It celebrates achievement culture. And I'm just going to bring the chat up. Okay. And the thing about that is I get these lists all the time. There was a weird period of time where we got a lot of magazines in my house, and we were getting a lot of these celebrations, whatever magazines, 30 under 30 lists for that year. Forbes is pretty famous for theirs. But then, I was just like, why aren't we celebrating? Why aren't we publicizing? Why aren't we making more visible the remarkable older people in our communities, and the fact that there are so many more older people. So it was just like really kind of a reflex. Like you want to do 30 under 30, I want to do 80 over 80 to highlight all the wonderful people that I know who are 80 and older. And I guess what I would ask you is, if you were to have that idea, what idea would you have next? I want you to think about it now, just because as I present what we did, you can, you know, maybe you'll have had ideas for things that are now missed opportunities for us, or it can be our next project, for example. But I think some people might say, well, and they're out there, you know, there are podcasts and various lists out there, or documentaries or whatever, about people who are older, but somehow break some sort of stereotypes or preconceived ideas about what older people are like the guy on the left, who's very youthful appearing. He's got his funky headphones on. You know, style is super cool at all ages, but I think the message of the guy on the left is that he has sort of a youthful look, quote unquote, for his age. So that might be one approach. Another approach might be, sorry for the fuzzy picture of our president here, but, you know, Biden's going to be 80 in November. So he's, you know, we can, he'll be 80 this year. So is it really about people who have achieved something particular? So not that they look youthful per se, but that they've done something amazing in their later life. So that's another approach we could have taken. And then on the right is somebody we actually did profile. This is Janie Bell, and she's a resident in San Francisco. And she was, you know, had a full career in terms of only retiring a couple of years ago in her mid-80s from work of various kinds. She basically had 2 careers, but one of the main ones was serving people with disabilities, particularly children in the city with developmental disabilities. So that's somebody who's contributed in lots of other ways and is part of our community. And we took more of that approach, obviously, since we talked to Janie. So the things that I want you to keep in mind that we were thinking about when we were making this project are that we are an aging city. And of course, we look to the great data and information that DAS puts out there, and the Dignity Fund put out there all the time about what we know about our older adults. And what we know is that we're, you know, getting to a point where we're almost 30% older adults. And that's defined as people 60 or older. But the general trend around the country, around the world, is that communities, cities, countries are aging in a way that it's going from a population pyramid to a population column. And we have more older adults as a percentage of our total population than ever before. So it used to be that we used to have a lot of very young people, and they just didn't survive into adulthood. And now, with a lot of obvious advances in public health and medicine, we have a lot of people that live very long lives, and other lifestyle factors and reducing accidents and things like that. So with so many older people, it's just a different kind of society, and that's something to really celebrate. It's a new phase in human community and life. The other thing we were thinking about, though, is ageism, and really inspired by a lot of the work already done in the city, which I'll refer to in a moment. But ageism is discrimination. In this case, discrimination that really sidelines and silences older people specifically. And that's Ashton Applewhite's definition. She's an activist in this area. And her book is called This Chair Rocks. And, we wanted to, I guess, give more voice to older people with this project. And so one example is Reverend Glenda Hope, who now in her mid-80s is doing a lot of work specifically on behalf of older adults in the city with her current activism and work, but is well known for all of her work in the Tenderloin with her Tenderloin Neighborhood Ministries, serving in a charitable way many of the people living there for decades. So that's something that she's not necessarily a particularly silenced person. She knows how to get her voice out there, but at the same time, highlighting her among many others could be a way to give more voice. And the nice thing about this project is it's 80 people. That's a pretty large number. So lots of voices. The other thing about ageism that was certainly on my mind specifically is how it affects health. So I obviously have this preoccupation because I'm in healthcare, but we know that ageism is actually directly dangerous to older people, specifically because of the way that healthcare, and in this case also, there was this article by Louise Aronson almost as soon as the pandemic started about ageism making the pandemic worse. So it was affecting the public health response as well. And the issue there is that, you know, the way medical care either disregards certain symptoms that older people might have or over-treats certain things, it gets to a place where we're doing more harm than good. And this was her argument in this article, that the way they weren't really thinking about older adults and their needs in the public health response was making it worse for older people and making it worse for everyone. It's a great article, and I would love to review it, but I'm mindful of the time as well. I think the other thing is, which is really kind of interesting, is there's been more attention lately. It's this information has been out there, but someone named Dr. Becca Levy just published a book called Breaking the Age Code, and it's not how to live forever. That's not the point of this book. The point is that actually ageism, when it's internalized, affects our lifespan. So when we have negative views of aging or older people, when you compare people with the negative views to the people with positive views, the people with positive views live longer. And it's thought that our negative views that sometimes we internalize about aging might actually make our lives shorter or less healthy. So one thing that really inspired me was thinking, well, maybe this project can give people who aren't older yet more of a full idea of what it will be to be older, and in a way that isn't stereotyped, isn't negative, but positive. Just because hearing anyone's story, you relate, it's positive. It doesn't necessarily have to be about everything is roses or everything is wonderful in life, but hearing about from people who are older, I think helps everyone feel more optimistic about older age. And then the last thing that was on my mind was how little representation there is of older people in media or just sort of out there in ways that are, I think, positively and completely representative. And I have no idea why, but this photo on the bottom right is the most used photo from the stock images on Getty Images. And I'm not sure what it says about when people use photos of you know, quote unquote seniors. But we know that there's a lot of representation problems. And so I hearken back to, again, the great work that's being done already in the city through the End Ageism campaign, that I think this one marketing piece was so beautiful, showing the connections between our older, younger selves and our older, younger residents in the same time and place, how we're all connected. Age is a connecting thing. It's not a separating thing. And the fact that all of these qualities about humans are enhanced and present at all ages, right? Passion, leadership, creativity, courage. And so this was a really big inspiration as well for this project. Intelligence, sorry, I didn't read the last one. And then just so you know, there's some work out there that is useful if in terms of your own work or messaging about ageism. So Ashton Applewhite's work on Old School, which they have a lot of resources there. And then something called the Frameworks Institute has resources to sort of talk about aging in a way that doesn't reinforce ageism. And then another tool is actually, I found quite interesting, is there's tools out there to see if you do harbor ageist views or are ageist. And one of them is the woman whose book I mentioned, Breaking the Age Code, Becca Levy. Her book website has a quiz. It's very short and sort of tells you whether or not how you compare to the rest of the American population in terms of your ageism. And then there's a series of tests for everything, pretty much. The implicit harvard.edu series of tests. And one of them is about aging. And you can sort of get a sense of if you're implicitly ageist or not, because a lot of us don't realize we have these views, and most people are at all ages. So ageism is one also that they've noticed has not made a lot of progress. So bias against people who identify as LGBTQ and anti-Black bias has gotten better in the last few decades, according to this Harvard group, but ageism hasn't really moved in quite a while, or at all, since they started looking at it. Okay, so that was the background. That's what we were thinking of, or at least I was, and really motivating some of the project. And so what did we do? How did we want to talk to 80 people? Where were we going to find them? How did it work? And so our goal to really just talk to people who are older, who live in our city, in our county, who, and by virtue of that, are extraordinary and worth celebrating, who have something to say about, of course, their background, what they've learned, advice that they would give, defining moments in their life, but also what are their lives like now? What do they think about the city now? Because another piece was to really emphasize the fact that the 80 that we're celebrating, what are their lives like now? That was the snapshot we wanted to give. So we, again, really just wanted to hear people's stories and find a way to celebrate 80 people over 80. And the only criteria was being 80 or older and living in San Francisco. We wanted to do our best to get a diverse representation, because if you look at all the data about older adults in San Francisco, majority non-white, and we have all these different groups represented. And in fact, I think it's over half speak a language, prefer a language other than English as their primary language. And so it's really kind of a fun message that there's this really cool thing to celebrate, that so many of us are older in San Francisco now, but also that in a really big way, that's an extraordinary thing, both for the individual and for us as a community. So those were the kind of things we wanted to celebrate. One thing I've been asked a lot is why 80? And especially I was asked that when we were struggling to finish the project, like, do you maybe want to do 60 over 60? That might be a little easier. But I think I really wanted to latch onto an age that I felt a lot of people would identify as belonging to older age groups. I think 60 and 70 are more, people aren't really sure if they feel like they're older. And I don't really like the word old because it's not clear what old is, but I think there's a degree to which being in the 80s and up is people are more comfortable self-identifying as being older. And it's sort of acknowledged as later life more generally. But I would love your thoughts. And again, you can share this at the end or pepper it in the chat if you wish. And one thing I just want to emphasize is that we're kind of muddled around age and what age even means. Why is it a useful cutoff anywhere? I mean, we had to, as a practical matter, pick something. But the concept in Louise Aronson, who her article about the pandemic I mentioned earlier, her book Elderhood, which I know many of you probably have read, really emphasizes that, like childhood, elderhood has many stages, many different sort of chunks, and we just don't really identify them, and we don't really, because we're not really focused on the fact that our older life, let's say middle age and above, has these stages. We don't really have good ways to identify those stages in some ways because we haven't really been thinking and talking about it. But I think about that a lot. What is elderhood, and what are these cutoffs? In a lot of ways we don't know. But anyway, 80 was convenient. It's a beautiful number, and we stuck with it. One things we weren't trying to do, as I sort of signaled in the beginning, is we weren't trying to just focus on someone's notion of a super ager, a positive aging project, or graceful aging. Those are all really wonderful things. In some ways, there's some evidence that it reinforces harmful stereotypes about aging because it implies that other people are lesser than for the way that they age, when really there's not necessarily a lot of control over it. And of course, we celebrate great health at any point in life, good health. So it wasn't one or the other. We weren't trying to emphasize, health status or some sort of, super aging status in any way, either in the negative or the positive. We didn't do like a life review project, so we weren't able to spend so much time that we got really people's whole life stories, in part because that's like just a kind of a different project. And so this was more of a snapshot of people in their lives now. And then it's not overly curated, meaning if we got a referral or a connection to somebody, we just went for it and tried to connect with the person and profile them. We love any of the referrals. Many people said no. We never really turned anyone away unless they seemed like they didn't understand or weren't able to really agree to participate. Briefly, I just want you to sort of be able to see the questions. It was just one page of questions, and we asked people to tell them their name and how they describe themselves or how other people might describe them, a little bit about their connection to San Francisco, why they came, what they enjoy about living here and what could be better. We were obviously, so we started in 2019, about 6 months before the pandemic. So we dealt with the pandemic. So we started asking people about what they like to do when not sheltering in place. What's this experience been like? What does a typical day look like for them in general and how it might have changed, what they're looking forward to? Has anything surprised them about the COVID-19 response? Obviously, we were in a place that was doing pretty well with the response and, from some aspects. So a lot of people didn't have too much issue with it. We did ask for people's advice to younger people to reflect on what it meant and felt like to get older, what might have been surprising about it, how they use technology, what are the major values or principles that they live by, what do they find themselves doing that they didn't think they would do. Nobody, I'll be honest, really liked that question or felt like they could answer it. If they could witness an event, what would it be, past, present, future? And then what things make them happy, what things have they done for others that made them happy, and then describe a defining moment in their life. So that was pretty much the list of questions. And sometimes we would ask all of them and sometimes not. Sometimes people felt they could answer, sometimes not. And because we started before the pandemic, we did a couple in-person audio interviews, and then we started doing Zoom interviews. And some are entirely just written interviews. And then the pandemic kind of opened up occasionally and we could go back in person and get some audio or video, like in-person video. So I think you'll see if you explore our website and the videos or like the various people there, you'll see that there's a real diversity of media. So we just went with what the person wanted to do and what we could do. Some people did not want their face or voice being showcased, but they were okay with us writing something. So everybody kind of had a different comfort level and we wanted to respect that. We had so many volunteers, so many. And these that did volunteer interviews or gave us references or took pictures or wrote something. And so some people I mean, it's almost hard to really say in words how incredible it was to get so much help and engagement. And this is sort of our core team, just so you can see some of the folks. These are our steering committee members who really early on, like we actually met in person and figured some stuff out about the project and the direction it would go in. And it's Marie Jobling from CLC, Louise Aronson, who I've quoted many times now, Jesse Johnson, who's a local poet, and Anne Fabini, who's a physician at the VA in geriatrics. This is Noelle has been one of our first volunteers and stuck with it the whole time and has really managed a lot of aspects of the program. These are our media editors, Zoe, Sophie, and Ozzy, and of various either audio or video editors. Everyone's up on our site, but just to point out again, like how many hours have gone into this project. Tracy has done our website, Tracy Ramos, Kendra Moore, Lulu Sai, and Jocelyn Coe all did early interviews. Lorena has her own Slap It. She's on the website. She has her own podcast with Nepali older adults. She's from Nepal and does a podcast and has a store where she sells some of the things they make on Etsy. It's Ageist podcast. Oops, excuse me. And then we had Victoria Frager, who's done endless things on the website, as well as many project management things, and interviewed many people. And Charlie, who's writing a lot of profiles for the book that we're putting together now that we have all of our 80. So finally, we're at the point to meet our participants. And I just want to give you a small sense of who we were able to include. And really, again, it was time. We wanted to celebrate this month, May 2022. As I mentioned, we started 3 years ago. So just so lucky to have found 80 people who wanted to participate. And of course, all of them are amazing. When you go to our website, you'll see that you can click to get right to the stories. We also have a watercolor map that an artist put together for us, Jason Hahn. And if you go, it's organized by neighborhood on the right side, and you can click on each of the names to see their story. And I'm just going to quickly show you all the neighborhoods. We just squished a bunch of neighborhoods together. We didn't want to necessarily pinpoint every single address on a map. So we just sort of squished neighborhoods together to get 10 neighborhoods. And we have kind of covered the whole city in that way. And just, I'm just showing you how many people 80 people is. It's a lot of people, which is so cool. So now I was going to introduce a couple of the actual participants and see if I can actually get the sound to work. So one of them, it was really charming, is Diamond Dave. He was someone who came and was really a big player in the beatnik era, the hippie era. And he says he's got a lot of hipstery to tell. And he started one of the first hosts on KPOO, the radio, and the Board of Supervisors on his birthday in 2016 named that particular day of that year as Diamond Dave Whitaker Day. And he's just, you know, a really a good example. I mean, he's just an old hippie, an old beatnik. And we did some stories with him in his garden, and he is really muffled already. It's hard to understand. On the website, it has some closed captioning subtitles that are sort of the generated ones that we're gonna improve to be more accurate. But you can you can watch it with subtitles on the website. It didn't work trying to download for this presentation. So after we sort of hear a little bit from him, I'm going to summarize so that it might be clearer for those of you who can't understand.
What would you say are the major values or principles that you live by?
I'm not open. Stay aware of what's happening in the world, even though it doesn't really matter. But on one level, but on the other level, I take an interest in it. Stay open, to stay interested, to stay alive.
So what advice do you have? And he says, stay interested, stay open, stay alive. So he's very, you know, he was always would ask me for New Yorkers. He was always listening to the NPR. He was someone who really wanted to remain engaged in the world and in what was going on, still had a real activist mentality. Oops, sorry. The other I just want to show really briefly is Rufus Browning, who moved here in the 70s and was on faculty at SF State and an educator and a researcher in political science, and married to Dr. Judy Goddess as well, who we also got to profile and who you just saw present. So really delightful. And he has wonderful advice about, you know, try not to eat, he keeps moving. I try not to eat crap. Well, a little crap. That's part of happiness, to take that kind of risk. So let's just see. He was also just really charming. Obviously, that's not him. That's me. Let's see.
My name is Rufus Browning. I'm
86, going on 87.
How would you describe yourself to others?
Serious, sometimes funny, inquisitive, curious, hardworking, caring.
Those are all really wonderful things. What things are you serious about?
Work and meaning. I became a political scientist and eventually found my way into research on racial politics. And in a sense, I can see my life has been a.
Oops, sorry. I'm sorry, my mouse is very sensitive, but we're almost at time, so it's probably trying to give me a clue there. I think you can get a sense of like the nice conversations we got to have, to hear people describe themselves, you know, caring, serious. He's serious about political science, like just understanding the kinds of things that give us all purpose, and that's different for everybody, but there's just something really, I know that connects me to other people when I hear them talk about their own interests. Someone else is Carolyn Chris, who has a beautiful, or goes by Lindy, has a beautiful English accent, but was here, worked at USF for many years, and after working got a bachelor's of fine arts and is an artist. So she talked to Kendra more early in the pandemic.
Is there anything that you've experienced in your life prior to this that compares to the COVID-19 pandemic?
Well, nobody has. I mean, come on, this has been so staggering worldwide. But I would suppose the beginning of World War II and World War II, because I lived all through that. In England, we had rationing until what, 1954. The food situation was worse after the war because they rationed potatoes and bread, and we didn't get dried eggs from America, which we'd been able to get somewhat during the war. Yeah. So we listened to the radio and heard Mr. Chamberlain give the announcement, and the air raid alarm siren went off, which was a new noise for me. My parents, of course, very upset, particularly my father, was a really big man, but very emotional, you know, cry over sad stories, sad films, whatever. So I helped my father. I was little, but, you know, my parents have a picture of me with my tin hat, and I think I'm wearing my swimsuit, helping to fill sandbags for our air raid shelter.
So Lindy talks about going, you know, being a small child during World War II in England and being a part of her family sort of getting ready for possible bombings. And I think that is something that, you know, because we of course did ask something about people's prior lives and different parts of their lives. Of course, the amazing thing about talking to so many people in their 80s and 90s, we unfortunately didn't have anybody in their hundreds, is that they have had some of these experiences, and that is something that is kind of, you know, hugely eye-opening and important for us to hear as well. So just again, another example, if you were to go and watch a whole video, they're all somewhere in the most of them are in the 15 to 30 minute range, and we'll sort of give you a sense of we'll give you a sense of sort of how the conversation goes and how awkward it is to record on Zoom. Okay, so I'm gonna start to tie up now. Oops, sorry. I will say, so another person is Tanako Hagiwara, and she gave a lot of really beautiful advice in her interview, and she was referred by 30th Street Unlock because she does so many cool programs there and is like kind of known as someone who really brings up others and creates programs. And just to point out, as someone of Japanese descent in America during her lifetime, she experienced, as did one of our other participants, being forcibly moved from her home. What's so crazy is her home was the Japanese tea garden at the time. She lived there with her family because her family had created the Japanese tea garden and designed it. I think it was her grandfather who designed it, and she lived in the tea garden and was not allowed to go back after coming back to San Francisco. But she's a native San Franciscan. So I'll just play a short clip.
If you could give advice to younger people or yourself when you were younger, what would it be?
Well, to younger people now, just enjoy whatever you're doing. You know, don't think too much about the future or the past. Just kind of live in the present. I mean, certainly you can't just put your head in the sand, but whatever you're doing, enjoy, because it may not come back again. You know, the COVID proved that some things kind of disappear if you don't take advantage of them. And I think it's wise to know that you have to take care of yourself in the future, but enjoy as much as you can now. Don't lose now because of yesterday and tomorrow.
So she had a beautiful way of summarizing her advice that, you know, enjoy now, don't stay rooted in the present or the past, or find ways to at least let those lie for a minute and enjoy now. And I guess take a measured approach with one's health. It's great to take care of your health, but you know, you have to, it can't be, you know, the only focus. You know, you got to enjoy life too, I guess. So she said it better than me. I was trying to paraphrase, but her interview is really why, you know, she gives a lot of, I think, the way she presents a lot of the information is really wise. This is an audio interview. I'll skip it, but this is Fanny. She lives downtown and fell in love with San Francisco, and it was a really, really fun audio interview because she, as she puts it herself, she's very opinionated and she has a lot of honest thoughts and is very clear. She's like, she was one of the only ones, actually. Most people used a lot of computers a lot during the pandemic, but she was like, no, not so interested. I couldn't care less about computers. And she also had some beautiful, and that's what this clip would show, but it's actually pretty poor quality, so I will skip it. With the way the stereo system is, it's hard to hear, but she kind of just mentions the way that she feels babied as an older adult, and that people seem to want to make decisions for her, and that doesn't interest her at all. And you know, that was advice she had, was do not baby older adults. At least if it's her, do not. I'm just wondering. So, and then I just wanted to point out, we have 15 interviews that are not in English, and they have translations on the page, and we're currently putting subtitles with professional translations on them. So the translations you see that are printed out will be on the actual videos. So a couple are just audio, but we have one in Russian, one in Mandarin, one in Korean, and 8 in Cantonese and 5 in Spanish. It's 8 participants in Cantonese, but 2 of them are couples. And obviously, like, who can resist watching Benson and Lisa's video here? They're so charming. And a lot of people shared other things on the page, like artwork that they've done or important experiences to them and photos from that time. So there's just a lot of diversity. If you click on each of the individuals, you'll see different things because everyone sort of contributed something different. Okay, so I've been asked a lot about lessons learned, and we are 3 minutes over, so I will do this in 30 seconds. I think it's hard to summarize 80 people for sure. I think a lot of overlapping themes were that older people are somewhat seem like experts in resilience. They've been through more than people who've lived shorter lives, often, not of course always. And it was more an experience of hearing about people's approach to life now, and really absorbing the fact that many were extremely resilient. Now, if new disability was occurring or something they had adapted to in their older life, or also just generally speaking, many people were connecting with San Francisco services, and everyone talked about different ways that they were active and engaged, mentally, cognitively, socially, physically. Really, I thought that was consistently really cool to hear. People seemed really, really engaged. And then when we asked them about like what could make SF better, it just all came down to the same stuff everyone talks about all the time, which is Housing is an issue, transportation is an issue, people experiencing homelessness is a particularly painful issue for everyone. And some people, however, did mention, and specifically among our Asian participants, that anti-older adult and particularly anti-older adults who appeared Asian, they felt that that violence was really, really scary. So I think that's unfortunately probably not surprising. We're going to start compiling some groupings. So we had a lot of people who had careers in San Francisco Unified. It was really incredible to hear about, had contributed so much to the education of next generations. Many were SF natives. We had a few famous contributors. So Orlando Cepeda, who's the only one who's a famous SF Giants player, who actually, unfortunately, was the only one who lived outside of San Francisco, but at the time of the interview, but obviously was just too wonderful to not include because of all that he represents for a lot of San Franciscans in terms of real pride about the city and the legendary contributions he made on the Giants team. Jack Hirschman, who I know many of you know has passed away, but the famous poet who lived in North Beach, and Dorothy Kwok, who's a Chinatown resident and getting a lot of, in my view, is pretty famous. She's getting a lot of attention for, and in a new documentary. Then you can find all the information on her page. And we're going to be compiling lists of artists and activists that were part of this project. One other thing that we had was a collaboration with KLW Cross Currents this month. So I will refer you to their website, but if you go to the Cross Currents page, you can find little 3 to 5 minute segments that have been airing on many of their shows this month. That include our participants. So Orlando was yesterday, and I believe Dorothy Kwok is today. And that's a show that airs at 5 p.m. And that was a real honor for us to know that KLW listeners would get a chance to hear some of the stories that we collected. And then we were really lucky, I think all of us here are already with the earlier presentations, amazed at the coalitions, the collaborations among organizations and residents to serve older adults. And we were really lucky to get great collaboration from a lot of these organizations to get names and connections to older adults. And we've been supported financially through a GoFundMe campaign, which had over 40 donors. The Meta Fund was very crucial in these last few months of getting this project completed. Senior Power and Community Living Campaign. And what's next? I know we're over time, so I invite you, you can find us on the website. It's very easy to email us, but it's also 80over80sf@gmail.com. And I guess I'm here to hear any feedback you have, any ideas, and of course, any questions. And I know we're over, so I'll let Mike let me know how long he would like me to stick around. I'm happy to stick around.
You can, we have lost very few people, so people are engaged and enjoying this. So I'll have Sarah chime in if we have questions, but if you have anything else you'd like to mention, go for it.
Yeah, well, we'll put it up on the website, and if there's a way to like sign up for updates on the website, like you just enter an email for newsletter updates, and we'll send or like email updates. Pretty much in the next couple of days, we'll have a date for a event in July to be a little more interactive with some panel conversation with some of the participants, and we'll have a book that is sort of like a Facebook of the project essentially. And so we'd love to invite you to that and would welcome you. It will be in person, but in a very airy, ventilated space. And yeah, I would love to know what people would want to see next or would want to hear about next. And we have one question. Whoops. This mouse does not like me. Can someone read the question because my mouse is acting up?
I got you, Anna. It says, such a good work, Anna. This is amazing. Thank you and your team, sponsors, and partnerships to do this.
Well, that's
a comment.
Thank you. Thank you.
And then also, Anna, if you want to send me all the information, I can send that out to everyone that participated today so they have it
great,
easily accessible.
Wonderful. Thank you. I guess I'll just say thank you, because I feel like a lot of people really helped shepherd this along and influence it in major ways, including finding participants, interviewing participants. Judy was a participant. She interviewed participants. She wrote about participants. She helped us find more participants. So she's really an MVP of this project, for example. Oh yeah, and then has there been similar projects like this in other places, asks one person. And so if you Google 80 over 80, I know there's one in Texas, and they do something every year, and I think they've done it for 5 years. It's not the same, it's not exactly similar in that I think I don't know that they actually do 80, or if they really focus on presenting people with sort of a certificate every year saying, you know, you're being honored and celebrated. But kind of similar idea, just getting a story out about, you know, someone who's contributing in some way. There are some, like, one outlet, Slate News, which is an online magazine. I think they did a 70 over 70. That was all people who are like big thinkers or have had some impact. I think they were focused on achievement or sort of broader impact than their community. And the thing personally I really enjoyed about this was really focusing on San Francisco. Like, you know, community is the people in the place at a certain time. And so how can being more aware of all these 80 people in our community, how does that improve our community, I guess, or bring us closer together? Somebody asked, how many seniors identify as LGBTQ? We actually were keeping track. We were keeping track of race, ethnicity, and LGBTQ, identification. I would say many, but it was not a big topic necessarily of the conversation we were having. Some people will talk about it really openly in the interview. Some people mentioned it later. Some people mentioned it and then said, if you don't mind, don't particularly, put that up. And so I think we actually decided not to do a bunch of labels other than neighborhood. We were going to do race, ethnicity, language, LGBTQ, SF Native. We have 2 participants who are Holocaust survivors. We have many folks who are, Jewish or identify as Jewish descent or are practicing. It got, I don't know, it started to feel weird to put these things up, but you'll see that in the intro, people will, it'll be a feature of how they identify and how, we decided to present them in the little blurb. But I would say it was something like at least 10, maybe 12 participants were LGBTQ, mostly gay or gay men or lesbian, women who identified as lesbian. We had no transgender participants. I'd love more thoughts about that though. Obviously it's such an important part to San Francisco is, how welcoming and important and how much the LGBTQ community has gone through in San Francisco and in this, last 80 years for sure. Well, I'm happy to wrap it up and just be there for anyone who has questions, comments. We have gotten a lot of emails and with additional ideas or thoughts, and we're keeping track and we're kind of thinking about what's possible and just really grateful for those suggestions. So thank you.
Excellent. Thank you so much, Anna. Super appreciate you joining us today with some really cool stuff. So yeah, people will know how to get a hold of you. I think that's it. Thank you. Thank you to all of our presenters today. Thank you, Sarah Hofferberg, for helping co-host this and doing endless behind the scenes work to keep this going. And thank you to our interpreters for joining us today and being part of this. Okay, so I think that's it. We're gonna shut this thing down. Happy Older Americans Month.